Thanks for joining us today. I'm Haydn Bush, online editor for Hospitals and Health Networks, and I'm pleased to announce that starting February 14th, our popular H&HN Weekly online publication becomes H&HN Daily. Subscribers will continue to receive thought-provoking commentary from healthcare thought leaders like Ian Morrison and Emily Friedman, enhanced by videos, podcasts, and blogs from H&HN's award-winning editorial team, as well as a look at the hospitals and health systems embarking on delivery system transformation. I'm joined today by H&HN's managing editor Bill Santamour and senior editor Matthew Weinstock for a preview of H&HN Daily, as well as an editorial outlook of the key issues facing hospitals and health systems in 2011. Thanks for joining me today.
Thanks, Hayden.
Now, how do you see H&HN Daily offering content and analysis for its audience starting in February?
Well, I think we all know that healthcare is changing and that it has to in many respects. But a lot of the catchphrases, a lot of the concepts that are being bandied about are pretty nebulous and I think bewildering. So what I'm hoping for with H&HN Daily is that it can clearly define the issues around advancing healthcare and creating the healthcare system of the future, and that we can spotlight real-life examples, people in the trenches, healthcare leaders, hospital leaders who are doing things that other hospitals and health networks might want to consider.
And I think too, what's exciting about the H&HN online product is that, you know, in the magazine we spend a lot of time doing a detailed analysis of an issue of accountable care or bundled payments, and it's, you know, we drill deep into those issues and we don't often get to personalities. And I think the ability for us to do podcasts and video casts with some of the subjects that we're interviewing are going to really bring people into that conversation, which is important for this transformation that we're going through.
And going back to those issues, 2010 certainly was a pretty major year in healthcare, both in terms of news and in terms of the political machinations. Where do you see the major issues lining up this year, just in terms of the content for H&HN as well as the online publication?
Well, I mean, there's a lot of discussion and debate in Washington and elsewhere about how the changes that were identified in 2010 are going to play out. But I think that we know that some things are going to happen. There's going to be a push toward accountable care, a push for continuum of care with bundled payments and being responsible for outcomes rather than episodes of care. So I think that those are kinds of, but describing those concepts is a little confusing, and we want to give real life examples, concrete examples of what hospitals might consider doing.
Thanks a lot, guys. And thanks for joining us today. To learn more about these key issues, visit H&HN Daily starting February 14th for enhanced multimedia content from the hospital executives and healthcare thought leaders currently featured in the magazine. That's all the time we have for today, and remember to visit www.hhnmag.com/HHN Daily starting February 14th. Thanks for joining us.